Hello, good morning, my dear students. Let's move on to part 3 of this question paper, category 238/2015, Assistant Dental Surgeon, Kerala PSC question paper, which was attended in the year 2015. Okay, so if you have not watched part 1 and part 2, go to the playlist area of eDental Formula channel. You will find all the model question papers along with the previous year's question papers, part 1, part 2. Okay, so coming on to part 3. Question number 86. The lymph nodes that are involved in acute necrotizing ulcerative periodontitis are confined to submandibular lymph node, sublingual lymph node, submandibular and sublingual lymph node, submandibular and cervical lymph node. Okay, so the condition here is acute necrotizing ulcerative periodontitis. There is a high chance that it will spread to the cervical lymph node area also. So option D is the correct answer. Submandibular and cervical lymph nodes are involved in case of acute necrotizing ulcerative periodontitis. Option D. Question number 87. The material which is present between the bacteria in dental plaque called intermicrobial matrix accounts for around how much percentage of the plaque volume? 25% of the plaque volume, or 35%, or 50%, or 75%? Okay, I'll read the question once again. The material present between the bacteria in dental plaque, this material is called as intermicrobial matrix. So what is the percentage of this intermicrobial matrix in dental plaque? It is around 25%. Okay, the percentage of intermicrobial matrix in dental plaque is 25%. Option A is the answer. Question number 88. The enzyme arginine 1 protease, which is present in biofilm, is produced by Porphyromonas gingivalis or Actinomycosis viscosus, Capnocytophaga or Treponema pallidum. So biofilm is a coating which is there present on top of all the tooth, isn't it? So this the protease, arginine 1 protease, is the enzyme present in this biofilm. It is produced by Porphyromonas gingivalis. Option A is the answer. Okay, Porphyromonas gingivalis. Okay, question number 89. Question number 89 was deleted from this question paper in the final answer key because there are 2 answers are correct in this particular question. Okay, 2 options are correct. Let me read the question. The desquamative lesion having an ocular manifestation. The question is the desquamative lesion having ocular manifestation. Options are pemphigus vulgaris, benign mucous membrane pemphigoid, erosive lichen planus, and erythema multiforme. So what I want is, I want you guys to comment below the video which are those 2 lesions having ocular manifestation. Okay, let me check. Okay, let's find out who gives the correct answer. Okay, comment below the video. Okay, the 2 answers are correct in this particular options given. Okay, anyway, let's move on to question number 90. The most ideal surgical treatment for a single tooth gingival recession is coronally displaced flap, subepithelial connective tissue graft, laterally displaced flap, free gingival graft. The most ideal surgical treatment for a single tooth gingival recession is laterally displaced flap. 90C is the answer. Okay, if a patient comes to you with a single tooth gingival recession, what you have to do? You have to take the laterally displaced flap and you have to correct the gingival recession. Okay, option C is the answer. Question number 91. Which is the naturally occurring catecholamine? Isopropanol, ephedrine, or dopamine, or levonorepinephrine? Okay, in many videos we keep on listening to, if you do this, if you do that, there will be a dopamine release, isn't it? So what is the naturally occurring catecholamine present? That is dopamine. Okay, option C is the answer. Question number 92. One of the following nerve is not anesthetized in go-gate technique of nerve block: auriculotemporal, lingual nerve, nerve to lateral pterygoid, or mylohyoid nerve. The nerve which is not anesthetized in go-gate technique of nerve block is nerve to lateral pterygoid. Option C is the answer. 92C. Anti-gum deformity commonly occur following total maxillectomy or alveolar ridge augmentation, gunshot injury of the midface, or total mandibular resection. Anti-gum deformity occurs after total mandibular resection. Option D is the answer. Question number 94. Following is not a clinical feature of superior orbital syndrome: ophthalmoplegia, forehead anesthesia, constricted pupil proptosis. Which is not a clinical feature of superior orbital syndrome? If you have a superior orbital syndrome, your eyes will be bulging out. So proptosis is present, but there is no constricted pupil. Option C. They are asking which is not a clinical feature. So constricted pupil is not a clinical feature of superior orbital syndrome. Proptosis, forehead anesthesia, ophthalmoplegia, all these are features of superior orbital syndrome. Option C will be the answer. Question number 95. Which of the following is not associated with temporomandibular joint pathology? Midline dysthema, open bite, deep bite, traumatic occlusion. The question is very easy. Answer is also easy. Midline dysthema doesn't have association with TMJ disorder. Option A will be the answer. Question number 96. Which of the following material is commonly used for making laminate veneer? Metal ceramic or injection molded ceramic or zirconia ceramic or InCeram? The material which is commonly used for making laminate veneer is injection molded ceramic. Injection molded ceramic. Question number 97. A desirable property of metal ceramic alloy. A desirable property of metal ceramic alloy is low elasticity, high thermal expansion, sag resistance, high flexibility. One of the desirable property of a metal ceramic alloy is sag resistance. It should resist the sagness. Okay. 97C. 98. Shaped blockout is used for removal of which of the undercuts? Removal of undercut in the proximal side, removal of undercut in the buccal side, undercut in the interproximal area, placement of retentive clasp. Okay, so the shaped blockout is used for placement of a retentive clasp. If you want to place the retentive clasp, you have to do shaped blockout. Okay. 98D. Question number 99. Minor connector for a mandibular distal extension RPD should extend posteriorly to the retromolar pad, half the length of the edentulous ridge, 2/3 the length of the edentulous ridge. Length is not a problem. Minor connector for a mandibular distal extension RPD should extend posteriorly to the retromolar pad, half the length of the edentulous ridge, 2/3 the length of the edentulous ridge, or length is not a problem. So there is no tooth in the posterior area, so you have to do the distal extension. So in that case, the minor connector should extend around 2/3 the length of the edentulous ridge. 2/3 the length of the edentulous ridge. 99C will be the answer. 100. Which of the following is an occlusal scheme not seen in natural dentition? If you go for natural dentition, whether you see canine guided occlusion, yes, definitely you see canine guided occlusions. Group function occlusions are also common. Mutually protected occlusion is also common, but balanced occlusion is not it's not at all seen in natural dentition. Okay, it is not seen in natural dentition. Okay, option A will be the right answer. So this comes to the end of part 3 of this question paper. So we have finally finished category 238/2015. Please comment below the video which are the topics you require urgently just before the exam. Okay, so November 28 is the exam date for this year to 2025. So which are the important topics, or which of, if you want any more question papers like this to be solved, please comment below the video. Or I recently received a comment to do a video regarding how to appear for the exam. Okay, how you have to fill the OMR sheet, how you have to manage your time for this exam. Okay, so what are the tips and tricks for attending Kerala PSC exam? So if you are interested in such a videos, I will do it again and again. Please comment below the video. If you like the video, please give a thumbs up. Okay, thank you.